हेलो फ्रेंड्स, आज हम लोग देखते हैं ऑपरेशन थिएटर पोजीशंस के बारे में। इसके पहले भी मैंने ऑपरेशन थिएटर के वीडियोस बनाए हैं। अगर आपको देखना है तो प्लीज़ मेरे चैनल को लाइक, शेयर एंड सब्सक्राइब करना ना भूलें। नाउ वी स्टार्ट दी ऑपरेशन थिएटर पोजिशनिंग। इन दैट, व्हाट डू यू मीन बाय पोजिशनिंग? In surgical positioning is the practice of placing a patient in a particular physical position during surgery to facilitate examination or any kind of therapeutic purpose. Now, purpose: to promote comfort to the patient, to relieve pressure on various parts, to stimulate circulation, to provide proper body alignment, to carry out nursing interventions, to perform surgical and medical interventions, then to prevent complications caused by immobility, then to promote normal physiological functions. Now, first one is the supine position. The most common surgical position. The patient lies with back flat on operating room bed. Usage of supine position. This is generally used for abdominal surgeries and those which requires anterior approach, head, neck, extremity for minimally invasive procedures. Now, prone position. In that, patient lies with stomach on the bed, abdomen can be raised off the bed. Uses: this exposure of the posterior body is used for the procedures of the spine, back, rectum and the posterior parts of extremities. Now, Trendelenburg positions. Same as supine position, but the table is tilted head down, so the patient's head is lower than the feet. Uses: provides additional visualization of the lower abdomen and pelvis, and for the patients who develop hypovolemic shock. Now, reverse Trendelenburg positions. It is same as supine, but the table is tilted feet down. Uses: for head and neck procedures and to provide visualizations in laparoscopic procedures in the upper abdomen. Now, lithotomy position. Upper part is placed in the supine position, legs are raised and secured, arms are extended. Uses: for gynecological, anal and urological procedures it is used. Now, Fowler's position begins with patient in supine position. Upper part is slowly raised to a 90-degree position. Uses of Fowler's position: primarily used for procedures involving the perineal region, pelvic organ or genitalia. Now, SEMI-FOWLERS position. It is lower part is in a supine position and the upper part is bent at a nearly 45-degree positions. The patient's head is secured by a restraint. Uses of SEMI-FOWLERS positions is commonly used for patients being administered with drugs or tube feedings. Now, jackknife position. In that, patient's abdomen lies flat on the bed. The bed is adjusted so the hip is lifted and the legs and head are low. Uses: examination and surgery related to anus. Now, knee chest position. It is similar to the jackknife except the legs are bent at the knee at a 90-degree angle. Uses includes: commonly used for rectal vaginal examination and management of a prolapsed uterus. Now, lateral positions, also called the side-lying position. It is like the jackknife except the patient is on his or her side. Uses includes: to relieve pressure on bony prominences of the back and sacral region. Now, kidney positions is much like the lateral position except the patient's abdomen is placed over a lift in the operating table that bends the body. A kidney rest is placed under the patient at the location of the lift. Uses of kidney position is to allow access to the retroperitoneal space. Now, Sims position. The Sims position is a variation of the left lateral position. The patient will roll to his or her left side, keeping the left leg straight. The patient will slide the left hip back and bend the right leg. Uses of Sims position. This position allows access to the anus. थैंक यू फ्रेंड्स, आज हमने देखा डिफरेंट ऑपरेशन थिएटर पोजीशंस के बारे में। अगर आपको कोई कमेंट करना हो इसके बारे में तो प्लीज़ कमेंट बॉक्स में कमेंट करें।